Hi there, everybody. It's Dr. Steve with your Understanding Your Pain. Here we are into part 2 of hip labrum issues. And so in part 1, we went into a little bit of the education, a little bit of the kinetic chain connections, the hips from below getting tight with lots of sitting and congestion in there, the abs and the ribs also being tight kind of adds to it. So we're going to do a bit more of a top-down approach today, lengthening through the front side of the body, and we're going to do sphere reaches. So for sphere reaches, we're going to stand with 1 foot forward, 1 foot back, and the big thing here is that if your feet are too narrow, it gets a little bit wobbly and your body is struggling not to fall over. If you put your feet a little bit wider, that's going to give you a wider base of support, make you a little bit more stable, and then you'll be able to move with a little bit more smoothness and confidence. But the idea of this sphere reaches, your sphere of function is anything out in space that you can reach your hands, grab and manipulate objects. That's within your sphere function. We're trying to expand that sphere in all directions. And we're going to do that by going in our 3 planes of motion. So first we start with the hands coming down and up. And as the hands come up, you want to kind of sink into that front leg and let the back leg lengthen. So as we're coming up, we're opening up the ribs, we're lengthening through all of this front side of the body. So we do some down and up. We're going to go hands overhead. Do a little bit of side to side with the rainbow pattern or the concert wave as we're going back and forth. And we're lengthened through the front, but we're creating this side bending so the ribs are opening up, going each way. And then we're going to do some rotations. Make a little more space so I can get my arms around the corners. But then we're going to rotate all the way around to both sides. So let me give you a little bit of the side view to give you that appreciation. Again, feet wide enough so you're not going to fall over. Starting with the down and up, you can see that as the hands are coming up, kind of bending that front knee, sinking the hips forward, but we want to keep this back leg straight, and ideally we want to keep the heel on the ground. Sometimes the Achilles and the calf are tight enough that gets a little tough. This one we call the all hail. Whoever you want to hail to is your choice. We're going to do the side to side. And so here I'm hoping that you can appreciate that the hands are staying kind of right along the side of my body. But this is where the hips are kind of swaying and we're opening up through the ribs. And then we do the reaching around the corners. Now, if you want to get extra credit, what you can do is repeat that whole sequence with the back foot turned out 90 degrees. Just like we were doing with the hip flexor stretch and turning it into the groin stretch, turning the back foot out 90 degrees, we can do the same thing with the sphere reaches. Position the body this way, hands going through all of those same motions, but what we're doing is positioning the body to expose and lengthen through all of this medial part of the hip and the groin muscles. So again, I'll give you the side view. Back foot turned out 90 degrees compared to the front foot, and that's where this little grid is kind of helpful to see where the feet are lining up. But then the hands doing the up and down with the all hail. We do the side to side or the concert wave. And then we do the rotating around the corners and trying to get around to each side as best you can. So there we have our part 2, and that was lengthening from the top down into all of this hip labrum, anterior medial part of the hip capsule into the groin muscles. And as we progress into part 3, Then we're going to do a little more challenging, a little different position, but getting into the lengthen to strengthen. So be sure to tune in, and if anybody that you know or care about is struggling with hip pain, don't let them sit at home and suffer. Send them in and let's figure out how to get them feeling better and functioning better. Until next time, bye-bye everybody.